talking to Dr. Chris Williams of Interventional Orthopedics of Atlanta. And Chris is in the business of regenerative medicine and other therapies, basically helping patients deal with pain and joint issues of multiple varieties. And so, without further ado, I wanted to welcome Dr. Chris to the show. Dr. Chris, how are you doing today?
Doing well, Joe. Thanks for having me, man. It's a real honor to be on the podcast, and I love what you're doing, and I appreciate it.
Oh, well, I just really appreciate you being here as well. And so thank you. I think maybe just to jump into things, let's have our viewers hear from you about your sort of journey into the business you're in now. I know that you have some military background and some other things you may want to discuss. So what got you into regenerative medicine and what you're involved with now?
Yeah, great question. Yeah, I'm originally from Jacksonville, Florida, born and raised, and went to the military after high school because I hated school, and so I vowed that I would never go to college. And military just allowed me to go through a lot of personal and career growth and development, and just a lot of discipline. I was exposed to, which really helped to allow me to become a more well-rounded individual. So, after doing a couple years in the military, being stationed in Kuwait, England, etc., started taking some classes online for free. The military provides free tuition assistance while you're active duty. So one of my friends, who was like, you might as well go and start taking some things. And so got an online associate's degree with University of Phoenix back when they were still rolling. I don't even know if they're still around these days. And got out of the military after about 4 years and decided to go to college, and did that full time, and decided, hey, maybe I'll go into medicine because fitness and health was something I really enjoyed. Looked at to going into medicine from the naturopathic route, but decided to go on the more traditional allopathic route, and get a traditional medical doctorate degree. And so came up to Emory University and did that and did residency, and was very into, during this time period, health and fitness and orthopedics. And so traditional surgery was not really my thing. The personality was not a great fit for me, and also wanted to learn more about other alternatives. I always looked into holistic remedies, natural remedies, minimally invasive things to help get folks back to function. And so when I found out about interventional orthopedics, because traditional orthopedics and traditional interventional pain management, it can provide some relief, but it's more of a recurring cycle, kind of a recurring door of patients kind of coming in. You do a cortisone injection or physical therapy, they get some transient improvement, then they're back to see you. And so I wanted to do something that provided an alternative more for long-term relief. So it was very interesting to me to be able to do things like PRP, or platelet-rich plasma, bone marrow concentrated stem cells, or adipose tissue and exosomes, and all of these different types of treatments to provide patients with long-term outcomes to really help them get back to optimal functional, whether you're just a weekend warrior or adolescent, or an elderly person. Everybody has some level of quality of life that they want to maintain.
Yeah, absolutely. Well, you're doing a great job of it so far. What's the history of your practice? How long have you been in business then?
Yeah, so I after my residency at Emory in physical medicine and rehabilitation, I decided to do a fellowship in interventional orthopedics and regenerative medicine in Colorado. And I did that for a year, then worked there for about another year as an attending physician, and came back to Atlanta to open my own practice in 2018. And Cinco de Mayo, so May 5th, 2018, we just hit our 3-year anniversary the other day here. So been rocking and rolling for 3 years with the first practice of this sort with Regenix in Georgia. And then, my practice is in Buckhead. And so we have a practice in the first medical office space building in Buckhead in the past 15 years. And so it's been fun. It's been a good ride so far.
Yeah. So talk a little bit about IO Atlanta and, what's special about it? What are you guys doing that's maybe a little bit different or just, what's the hook to get people, compelled to come in and just take notice of, what you guys are doing there?
Yeah, I think there's definitely a paradigm shift of consumer demand as well as, physician or provider demand of finding alternatives that can really prevent surgery or help augment surgery, because we know that surgery is definitely something that is necessary in certain circumstances. But I think in our Western society, we definitely over surgerize people, right? So people are looking for alternatives, for ACL tears, rotator cuff tears, meniscus tears, disc herniations, or, multiple different injuries. And how do they do that from a minimally invasive standpoint, or, just preventing patients from getting knee replacements, right? So, we have a lot of patients that are 40, 50 years old that have blown out their knee from doing a multitude of activities or having trauma, and they're just too young. They don't want to go through that yet. And so, we provide an alternative, and functioning at a high level that's really founded in data. That's our whole things. We always try to found what we do and from a research driven aspect as much as possible, because there's always going to be some level of theory out there. But if we can, base our treatments based on the most and best available research out there, then we really can ideally predict some outcomes for patients and be able to provide them with a certain level of comfort in doing the treatment. So, our thing is that, we want to provide high level care, great professional services, and also get you back to having great functional quality of life, with having minimal invasive treatments.
Sure, sure. Yeah, and I know more and more people are opting for other ways to avoid surgeries and avoid painkillers and opiates and things like that. And so, you
Absolutely.
guys, I love what you're doing there because I love to see anything that uses a natural, more holistic approach to getting people back to, like you said, get back to their life, get back to what they want to do. And you're right. These in this day and age, a lot of people, even young people, are facing sort of degeneration, in different joints and things like that, just from, I don't know if it's in the environment or from diet or from overuse in sports or what have you, but it seems to be pretty popular these days in terms of that type of ailment. And
Absolutely.
so and so give me an idea of how far your patients will come to see you. Are they right from the local community? Do you have any little more reach than that? Or talk about that a little bit and sort of talk about the demographic in terms of age and whatever other factors for demographics, if you would.
Fair enough. Yeah, I have a huge map in my office, of the world, and I put a sticker on there for every patient that travels. And so I've had folks come from, Saudi Arabia, Canada, etc. So people do travel. About a third of my patients are outside of the Atlanta metro area.
Hmm.
So people travel in a lot from the Carolinas, Alabama, as well as Tennessee, Florida, also. So drawing largely from that Southeast, but I get a fair amount of folks from the Northeast and New York, et cetera, as well. So, we do hit the local market, but, we have a wide reach because there's not a lot of people that are doing what I do at a high level, at this point. There's some providers that are starting to get into it, and I work a lot with some of the docs at Emory as well, who are doing some great things also. But, for somebody like myself that can treat the whole spectrum of musculoskeletal injuries from the base of the skull down to the big toe, there's not many people out there doing that.
Understood. Okay. Well, good information. Um, okay, switching gears a little bit. Let's talk about 2020. Several people had challenges with the past year and a half or so, in pretty much all walks of life. And how being in Atlanta and just really kind of on the outskirts of the city itself, but still, in Atlanta, how did that affect you guys? And sort of what are some of the things you've done to kind of come through that? Or are you still facing issues from that? Talk a little bit about that if you could.
Yeah, 2020 was the good and the bad about it. It was great for several reasons, but not so great for many others. And so many people, from a medical standpoint, there's about 11% of medical practices, outpatient clinics, had to shut their doors permanently and did not survive the pandemic. So, we did close down for about 8 weeks. We're primarily just doing telehealth, just because during that early phase, nobody really know what this was, what it was going to look like, how to keep patients safe. And so, as a medical doctor, you take a tenant to first do no harm. So my whole thing was to just shut it down until we know more. And running the type of business that I run is difficult. I run a cash-based business. It's not the traditional medical model. I pride myself on being able to give patients high level quality and not sacrificing on time. So typically I'll spend an hour with the patient when they come in to see me for their initial visit. And not running the insurance model, it definitely was a little bit tough. So, revenue was definitely down, but we had some, storage in the bank. So we were able to keep all of my staff employed and paid during the shutdown and everything. So just make sure we took care of people. We came out, I think, stronger. We're, back to doing things pre-pandemic. Everybody has to be a little bit more creative, I think, in terms of how they're doing business. And I think the pandemic definitely was good in allowing us to understand how to be more efficient with how we conduct business, as well as looking at different avenues and telehealth and remote working and working from home. And how do we institute those technologies so that way we can still, because you can't remotely do everything, that's for sure. But how do you maximize that aspect of medicine, but also provide high level service and quality at the same time? So we got through it. And it's been great, because the good thing about COVID was allowing us to refocus on what's important, right? Because at the end of the day, working 50 hours or 80 hours a week or whatever it is not the end all be all. So it allowed us to refocus in on, family and spending time with our loved ones, and, trying to make sure our staff was having a good work-life balance and all of those things. And, coming out of it in a way that made us have a stronger work community.
Yeah, definitely teaches you balance going through something like this. And it sounds like, your practice, your approach to the way you practice is, like you said, on a more personalized level than maybe someone might imagine. A patient that comes in to see you, say you spend a lot of time, even an hour with patients on their first visit, doing a consultation. There's not too many people doing that these days in more of the, you look like an allopathic practice, but you act a lot like a holistic practice. And so that's a balance right there, I think. And that's just sort of an outsider looking in, but that's sort of the impression I get. Would you agree with that?
Yeah, I would agree. A lot of the traditional medicine approaches that a lot of my peers use for orthopedic injuries, I don't necessarily believe in and don't practice. I don't do cortisone injections. I don't prescribe patients non-steroidal anti-inflammatory drugs because of all the detrimental side effects that they have. Yeah, I think they're just overutilized. But I do provide and prescribe a lot of supplements, turmeric, fish oil, black seed oil, look at different therapeutic modalities, blood flow restriction, pulse, and even, TENS unit or electromagnetic therapy in terms of different spectrums, and also neurodiagnostics as well. So you're just providing patients with options to really look at treating the pain paradigm at multiple different aspects is always helpful, and try not to do harm to people with also helping them at the same time.
Yeah, and it's funny how a lot of these natural approaches have really been quite effective, and people are willing to pay cash
Absolutely.
for them. A lot of times, it's maybe their last thing that they're trying, and they're frustrated, and they come to you. I'm sure a lot of your patients come to you frustrated, and so there's some education there of making them feel confident and comfortable, and so there's a lot of rapport building and relationship building there. I would imagine too. So it all sounds great. And I know you touched on it a little bit. We know each other from the Pulse relationship. You're one of my real good Pulse PEMF clients, and albeit a newer client, and just kind of getting rolling with it over the past several months. So maybe talk a little bit about how you were introduced to that and what got you into doing that and what you've seen so far from that, if you would.
Yeah, so PMF, I guess I learned a little bit about it during my residency training, in terms of treatment of stroke patients. They were then dabbling in DBS or deep brain stimulation with electromagnetic frequency waves. And so looking at improvement in outcomes. And then fast forward a couple of years later, I was able to meet you at some of the conferences a couple times and just learning more about some of the technology and how NASA institutes the technology, and then looking into the research and data. I really thought it was something that could be another adjunct for patients, So in terms of augmenting what I do, but also for patients that aren't necessarily candidates, because just because you walk through the door and have a checkbook out, that doesn't mean that you should get a treatment, right? So maybe something else like PEMF may be a better type of treatment for you. So, looking at it to augment patients and also sustain patients as well that have chronic injuries that I possibly can't fix, something like Ehlers-Danlos syndrome. That's a genetic condition that I can't correct, but that may benefit from something like a PEMF technology, or osteoporosis, or other different types of pathology as well. So I find that it's a great modality that I really try to educate patients about on their initial visits with me. I give them pamphlets and educational material on it. And for most of my patients that get treatment, I try to incorporate it into their treatment as well, just because I think that it provides a secondary benefit to the healing process after they undergo treatment. So
Sure. Yeah, excellent. Are you typically using it prior to a procedure, like a knee procedure, let's say, or afterwards, or both, or what's kind of been your method of preference?
I usually like to use it for patients if they're doing like a platelet-rich plasma or PRP treatment. I'll try to do it prior to and then a couple sessions after.
Mm,
But if this is somebody that has an acute injury, that for me, I usually try to give it at least 6 to 8 weeks after somebody has an acute injury, because we just don't know where the dust is going to settle, right? The body may be able to heal it on its own, but then I'll utilize something like Pulse to help augment their own natural healing response before I go rushing in with the needle, because they may be able to get there on their own in combination with PMF and maybe some physiotherapy and other modalities. So
mm.
that's usually kind of how I, incorporate it in. Or if I have somebody that has been a chronic patient that may not have had a good outcome with what I do, because nothing is guaranteed, then I may shift them over to try PMF as well. Or if a patient is, like I said before, is not a candidate. So I have sometimes patients that, because what I do really depends on the overall health of the vessel, right? So the human being, if you're not as healthy as you necessarily could be, if you have a lot of medical illnesses, you are, morbidly obese, you're diabetic, hypertensive, hyperlipidemia, then we need to optimize your health, because I don't like to waste people's time or money. And so if I can optimize your health and allow you to get some of those other conditions that are modifiable under better control, to allow you to get the best chance of having a good outcome from the other types of interventional treatments that I do, then I think it's a win-win. So while we're getting you through that optimization phase, Pulse may be a great adjunct to get you out of some of your chronic pain, and allow you to be more active as well.
Yeah. Excellent. Love that approach. Thank you for that feedback. So in wrapping up, I'm interested to hear sort of where you see your industry going, where you see the regenerative space going, near term, long term, and then mention if anyone wants any information from you or wants to reach out to you, what's the best way to go about doing that?
Awesome. Yeah, Ortho-Biologics, as we've kind of transitioned from regenerative medicine, because we now have a better understanding of the basic science level, that a lot of times there is not necessarily a lot of tissue regeneration, but more modification of the inflammatory response. Sometimes we get tissue regeneration as well, but the field of orthobiologics or biologics in medicine is booming. It's going crazy. Everybody's trying to do it, with some pros and some cons to that as well, because when there's an open space, there's always going to be some bad actors that come in and try to fill a void for monetary purposes, right? So you have patients that may go and try to get treatment because they have devastating conditions like multiple sclerosis or Lou Gehrig's disease or myasthenia gravis or spinal cord injury. And there is not a lot of data on those types of things yet. So I really stick to orthopedics. There are a lot of papers. I get a set of articles emailed to me each day from PubMed. It's probably about 100. And so there are about 50 to 100 articles published on these regenerative medicine types of treatments on a daily basis. So I think the field is going to continue to evolve. I think there are going to be more practitioners start to incorporate these things into their practice. Of course, orthopedics is kind of leading the charge with that right now, but other fields such as plastic surgery is utilizing more of these types of treatments. Of course, everybody knows about the PRP facials, PRP for hair transplant augmentation, fillers for skin augmentation, some urology and also gynecology treatments for sexual enhancement or even vaginal rejuvenation as well. So there's a lot of things that's going on. So I think it's a field that's progressing rapidly. I think insurance will start to cover more as more research and more public demand calls for it as well. TRICARE has now started covering PRP for knee osteoarthritis and also tennis elbow as well. Regenix, the company that I work with, they have really took and led on the charge of getting these procedures covered by corporate employers who provide insurance for their employees, so the self-funded employers. And so as of January 2021, they onboarded 51 new companies. So, at the end of the day, when you present the data, it's kind of, it's a win-win, so if you have somebody that can go and get a knee replacement versus a bone marrow stem cell procedure, and there's a $40,000 cost differential, most of the time the employer is going to say, well, is it as effective? And does it work? And what's the cost savings? So they don't have a problem with giving this procedure as an option to their employees. And so things are looking great on the horizon for sure. I think there's going to be more and more public demand as education and more celebrities start to do these treatments, because that what kind of drives a lot of research as well as changes as there's more attention brought to it. So you have, people like, Steph Curry and other NBA players and NFL players that are getting these types of PRP and stem cell treatments all the time now. And the public is becoming more aware of this alternative as well. So future looks great. So I'm always available. I can be found on Instagram, ATL Stem Cell Doc. I do a little bit of Facebook, but not as much. And the website is www.ioaregenerative.com. It has a plethora of information, blog posts on a weekly basis as well about orthobiologics and regenerative medicine as well.
Excellent. Fantastic. Well, I really appreciate it, Dr. Chris. If you like what you've heard and seen on this podcast on Resilient Business, please like, comment, and subscribe. As we wrap up here, view our affiliate links below for some great products and great discounts. And I just want to thank you again, Dr. Chris, for appearing today on Resilient Business. Thank you very much.
It's my pleasure. Thanks a lot. Be safe.
All right. You too.